All right, welcome back. Let's just continue the discussion on the Health Ombudsman Report by Professor Malegapuru Makgoba that was released yesterday on the investigation into the circumstances surrounding deaths of 94 mentally ill patients. The report has found an array of evidence of flouting of procedures and lack of care of lives during the relocation of patients by the Gauteng Department of Health. Well, we are in conversation now with Jack Bloom. He is the DA's Shadow Health MEC, and we are also speaking to Christine Ngumalo. She's a family member of one of the patients, and she also lost a loved one. Good morning to you, and thank you so much for coming through.
Good morning. Nice to be with you.
Thank you so much for coming through. Now, Mr. Bloom, let me just start with you. I know that a few days ago when this report was leaked, the DA urged the Premier to axe the MEC immediately. Are you satisfied now that the MEC has resigned?
Well, it can't be. Look, I think she had to go, and I think that it can't be the end of the story, though. I think that criminal charges need to be laid. She can't be let off the hook just by resigning. And in fact, last year already I called on the Premier to fire the Health MEC. In fact, he should have done it then, because then I think they could have started to fix up the problems in that department a lot earlier. Even as we speak, there are patients in NGOs who need to be transferred to proper facilities, and that process could have started last year. So yes, I'm glad that she's left. She should have gone long ago. Yeah. It's not the end of the story, and I think there'll be criminal charges laid against her.
And you also quoted as saying that you feel that the Premier is trying to protect the MEC. Why would you think that he would do that?
Well, she's an ANC heavyweight, and she should have been fired last year. There was another instance where the Premier did fire an MEC, the MEC for Sports, Arts and Culture and Recreation, and that was far less charges that were laid against her. So the Premier can act decisively when he wants to. He chose not to act against Kwadani Mshlangu, and unfortunately we face the consequences. So she was protected.
Is it really not where the DA comes in as the main opposition party? Didn't you fail in doing oversight yourselves as the DA?
We didn't fail, because in fact this whole thing started because I asked a question in the Gauteng legislature about the number of deaths. She said there were 36 deaths at the time. Turns out that she lied. On that very day, 13th of September, it turns out, according to the Health Ombudsman, there were 77 deaths, and now it's risen to over 94 deaths. So that was the oversight that the DA did. We were very strong in the legislature. I visited these NGOs. I've raised it at every turn. Unfortunately, the MEC herself was incredibly stubborn, and the Premier himself was slow to act, and we are now faced with the consequences. In fact, I think that he should resign as well, because he does share the blame in this whole sorry saga.
All right, Sis Christine, let me just bring you here. You've lost a loved one. Talk to us about your story. What happened?
Well, my sister was at Life Esidimeni. She was moved, got an SMS on the 30th of June that says she's being moved to Cullinan, and that the facility was closing. And at the bottom of it was given a telephone number to call. Call the number, there was no response. Basically, the number wasn't working. I literally spent about 2 weeks or so just trying to track her down. She wasn't, when you call Cullinan, she wasn't there. They say no, she may be at the other NGOs, and when you call the other NGOs, they can't track her. And eventually Cullinan accepted, saying she was there.
All right, and eventually...
Eventually on the 25th of August, I got a call from a lady called Ethel, who then told me that my sister had passed away on the 17th, and then later found out that it was actually on the 15th that she died.
But where did she pass away?
In Attridgeville.
In Attridgeville.
At an NGO called Precious Angels.
Which is a totally different NGO that you were given.
Yeah. She was supposed to be at the hospital at Cullinan Centre.
Yeah. But how do you feel as the family when you had the Ombudsman, reading the report yesterday? Is it really making you feel better? Do you think that you'll get to find that closure?
Look, we suspected all this. I mean, some of these things we alluded to, that they were hiding information, that something was not right. Because if you listen to some of the stories of the family members who've lost, it's harrowing stories. So what he was saying, he was just confirming our suspicions. Feeling better. I'm feeling better because the report said what we were hoping it would say.
It's confirmed
what we had suspected. Feeling better about the whole process? No, because it's now 94 deaths. I mean, we were at 30, as far as we know, we were at 36, 39 at some point. 94 is way too high.
It is.
It's just too high.
Yeah. It is quite a tragic, one of, the tragedies that South Africa has ever seen, Mr. Bloem. What do you think should be done going forward? I mean, you mentioned, one aspect of criminal charges being late. Are you looking into that as the DA?
Yes, we are. We're looking at it very seriously. I think there's probably going to be a class action suit by the relatives of the deceased. And I think everybody must be held to accountable, from the Premier to the senior officials to the NGOs who failed in their duties. I think we've got to also look after the present patients who are in unsuitable NGOs at the moment. We've got to look after them properly. Then we've got to look at compensation to the families of the deceased. But of course, nothing can bring back the lives of the person who died. But I think all of this needs to be looked at very urgently. Unfortunately, the Premier could have acted a lot earlier on it, but didn't. But let's do the right thing now. And we, as the opposition party, will monitor what's being done. And if nobody else is bringing criminal charges, we'll do so ourselves.
All right. No, unfortunately, due to time constraints, that's where we're going to leave it. But thank you so much. I do know that this is a developing story. I'll probably be in conversation with both of you again throughout, as the story develops. Thank you so much for coming through.